Okay, so welcome to tonight's Mastermind, guys. We're going to be looking through anatomy tonight. So we started the topic last week. We looked at your kind of elbow joint. We looked a little bit at your shoulder joint, and we'll do a bit of a recap of that this evening. And then we'll go into a little bit more depth tonight on the shoulder blade and how the shoulder blade moves up and down and how that helps your shoulder joint move around. We'll look at all the kind of muscles, the movements of the joints, all that sort of thing, and we'll have a bit of a discussion about why I'm waffling about anatomy in the first place and how I think that can be helpful to you guys. Is this anybody's first mastermind with me?
No.
No. Fantastic. Cool. Oh, sorry, a couple more people just coming into the room there. Hey, Paula, how you doing? Yeah, we can see you. Perfect. How you doing, Paula? All good?
Yes, thank you very much.
Fantastic. Cool. So just saying to the one more coming in. Right. I'll save it and then I'll say what we're about to do. Right, 2 seconds, sorry. Just let Babs into the room there. Evening, Babs. How are we doing? Maybe not connected to audio yet. So looking through anatomy tonight, guys, for those of you just joining us. So we're looking through kind of shoulder blade tonight. We looked at upper limbs last week, so we looked at elbows and shoulder joints. Tonight we'll look at shoulder blades. So just running through some basic anatomy stuff. Is this a first mastermind for anybody that's just joined us with myself?
Yes, for me it is.
Yeah, perfect. Cool. So as we go through, those of you that have been through kind of anatomy ones before with me, as you'll know, it's quite a lot of info as we go through. I don't want you to worry about that at all. Okay, I just want you to know something at the end of the session you didn't know at the start. Now, the reason we like to go through anatomy is because I think it helps with your training. I think it helps to have a good idea of where stuff is and what it does. And I think that can be a very useful thing with regards to training. I think it can really kind of help from that point of view. But anatomy is a huge topic. So what I've tried to do is condense it down to stuff that's really applicable and actionable for you guys within the training sessions that you'll be doing, either at home or in the gym or whatever it happens to be. Okay. So I shall share my screen. I'll ask questions, by the way, as we go through, but don't feel the need to answer if you prefer to just kind of sit back and listen. That is absolutely fine. I'm not going to pick on anybody. We'll just ask questions as we go, but please feel free to participate as much as you like. 2 seconds there, guys. I'll share my screen. Okay. Everybody see my screen okay? Should look like a big white screen with upper body anatomy in the middle. Yeah.
Yeah.
Perfect.
Yeah.
Fantastic.
Yeah.
Cool. So we'll go through a little recap to start off with. So why do we learn it? I think it's nice to understand how to target specific muscle groups. Okay, so we're all probably doing a little bit of resistance training here and there. We all probably have little muscle groups that we want to kind of target, things that we want to strengthen up, things that we want to build on. So it's quite nice to understand where things are and what they do, and that's going to help us with our exercise techniques, all that sort of thing. All of you, including me, will see exercises all the time that we've probably never seen before. Okay, no idea what the name of the exercise is. If you've got a good understanding of your anatomy, you've got a good understanding of what that exercise is doing, even if you've never seen it before. Okay, so it really kind of unlocks your ability to understand the why of the stuff that we end up doing in the gym. I think it helps with reducing reliance on cues. Okay, so a nice cue that I'll give a lot of people is put your shoulder blades in your back pockets whenever you're doing a row, for example, which I think is quite a nice cue. And if you all do that, you kind of do what we want to be able to do on a row. So the shoulder blades are coming back and down. We'll discuss a little bit more about that movement tonight. But if you understand that you just kind of contract your mid and lower traps and your rhomboids, you understand what those muscles do, it really helps to kind of inform your technique a little bit. So that used together with cues can be really, really useful. Okay, make sense?
Yep.
Cool.
Yeah.
And then I think it helps you adapt exercises to suit you. Okay, so not everybody's going to be the exact same shape and size. Gym equipment is designed with generally speaking, it can be adjustable, but generally speaking, it'll fit some people and not others. So if we understand what exercise we're trying to do, what muscle groups we're trying to target, we can sometimes chop and change them and adapt them to suit ourselves, to suit our own biomechanics a little bit better. So good understanding of anatomy can help you with that. as long as you understand what boxes you're trying to tick by doing an exercise, you can understand how we can adapt it for you. Yeah. And then I always add that little one at the end, which you may or may not agree with. You can let me know at the end of the session, but hopefully it is at least tolerable for you as we go through. Okay. So little recap, guys. We'll go through these kind of basic concepts now. For those of you just joining us, or if this is your kind of first time going through anatomy, or the first time going through a mastermind even with me, these are the main things that I want you to understand about muscles and what they do. So when a muscle contracts, it gets shorter, okay? Which means everything it's attached to, it pulls on, okay? So it's pulling on everything that it's attached to. Kind of muscle push.
No.
We're saying no. Do we agree with no?
I'm saying no, I'm guessing.
Guessing no, yeah. Anybody else
Yeah.
guess no? Anybody thinking a muscle can push? What do you reckon?
Pull, maybe, or assist you in pulling.
Yeah, muscles can definitely pull. Yeah, we know. Yeah, 100%. Can it push?
No, because it's to do with the other muscle working, lengthening and shortening.
Yeah, absolutely. Yeah. Yeah. So muscles can only pull. So if we're to do a movement that we would typically refer to as a push, it's just because muscles are pulling on different bits of us to generate that movement. But muscles can only pull. So a muscle can never forcefully get longer. It can only forcefully get shorter and relax. Okay, it can only get shorter and relax. These are the only two things a muscle can do.
I think I've confused myself now. I don't know whether I said yes or no. I don't know whether I said
You
no at the
said-
right time.
You guessed it correctly. Yeah, you guessed
I
it
did,
correctly.
right,
Don't worry
okay.
about that. Yeah, no, you were spot on.
Yeah, I got a bit confused there, sorry.
That's all right. Yeah. So yeah, muscles can only pull. Okay, what are they attached to your bones with?
Tendons.
Tendons. Yeah, absolutely. We heard of tendons before, guys. Yeah.
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 Perfect. So that's that kind of white tissue that you see at the end of the muscles there. Yeah. Something else you might notice, guys, is that there's a bit of a grain in the muscle. Can you kind of see that? Is often kind of depicted quite nicely in diagrams. So do you see the kind of striations in the middle there? You see the grain of the muscle, the direction of it, yeah? So if you'll put your fingers like that, okay, interlock them a little bit, right? Your fingers kind of mimic that grain at the minute. And then if you're to interlock your fingers, you see how that pulls in that direction. Whereas if I'm to change the direction like that, then I change the direction of the pull when I interlock my fingers. Okay, so if you look at a muscle, you can see the grain of the muscle, you can see the direction of that grain. That's going to give you a reasonable idea of the direction in which the muscle is going to pull on the stuff it's attached to. Does that make sense?
Yeah.
Yeah.
Perfect. Cool. So that is your tendon there. That's your bone at the bottom. Okay, so muscles attaching onto bone via tendons. Now, this is the analogy that I always like to use and I always want you guys to be thinking about when it comes to muscle groups, right? So we think of them as levers and pulleys. Okay, so I don't want you to think of these sessions as just trying to memorize an anatomy textbook because that doesn't really help you too much whenever we're training. Whereas if we think about it like this, it makes a lot more sense. So the way I like to describe it is if you were to get a rope and attach that rope onto an object and pull on the rope, you guys could probably all tell me which direction that object's going to move. That makes sense? Yeah. So if you've got a dog on a leash and you give it a little tug, hopefully not too hard, okay, but a little tug, you know which direction you're moving that dog, right? You're trying to get it to heel. You're trying to get it to move toward you. Okay, so same idea with muscles. They are just things that are attached to bones that pull on the bones, that moves the bones, yeah? And then we've got your joints or your axes. Okay, what are your joints held together by?
Ligaments.
Ligaments.
Ligaments, yeah, absolutely. Yeah, so we've got ligaments, so that joins bone onto bone. Have you all heard of like an ACL, for example?
Yes.
Yeah, so ACL, really common ligament to get injured, unfortunately. But ACL, that is a ligament, so your anterior cruciate ligament, it's called. It's one of the ligaments in your knees. You probably heard of spraining your ankle. So the word sprain there is referring to ligament, so that tends to be referring, well, the most common one is a kind of lateral ankle sprain, so that's ligaments on the outside of the ankles there, so that's what's holding the ankle together. And we all know if we've sprained an ankle, it feels quite unstable quite a long period of time afterwards, which is because the ligaments are a little bit looser. Ligaments are what holds your joints together. Okay, so that stops the joint from moving around all over the place. So if you imagine this axis here, okay, if that wasn't locked together, if that wasn't held in place, it would be like trying to open a door that's off its hinges, right? It's not going to move properly at the axis, at the hinge anymore. Okay, so does that all kind of make sense as concepts?
Yeah.
Perfect. So if we look at this diagram here, we can quite clearly see that if that muscle contracts, it's going to move that bottom bone upwards. Yeah, and that's because it has reached over, it's grabbed the bone, and it's moving the bone upwards, and that makes the elbow joint move. Yeah.
Yeah.
Fantastic. Cool. So that is all I want you to think about, guys. This is probably the most important slide when it comes to understanding muscles and what they do. Okay, because even if you don't know what those bones are on the screen and you don't know what muscle that is, you can look at it and you can tell me which direction stuff is about to move. And that's an incredibly useful skill to have, and far more useful than memorizing. That's a bicep. It's attached onto the forearm, and it's going to perform flexion at the elbow. That's stuff that we don't really need you to be able to reel off. I'm still going to teach it because it is the universal language that is used, but it's the basic concepts that I really want you to get your heads wrapped around, because that helps the most, I think. Cool. So elbow joint can do two main things, which is flex and extend. Okay, I'm going to fly through this bit now, guys, because this is a little bit of a recap from last week, and we'll slow it right down when we look at tonight's topic. Okay, so this is just a recap. So elbows can flex and extend. The tricep, that's the muscle on the bottom, extends the elbow, extends the elbow joint. Does your tricep cross over the elbow joint?
Yeah.
We're thinking, yeah. Is everybody thinking, yeah?
Yeah.
Yeah.
Yeah, perfect. Why are we thinking it does?
Because it won't move it anymore.
Absolutely. I wouldn't be able to move your elbow joint if it didn't cross over it. Yeah. If I want my elbow joint to move, let's say this was just a dead arm, so it's not moving. How am I going to make my elbow joint move? I've got this hand handy. How am I going to make my elbow joint move now?
At the bicep.
I would reach over, wouldn't I? I would
Yeah.
on the forearm, and then I would move like that. Yeah. So muscle has to reach over the elbow joint, grab the forearm in order to move it. So what your tricep does is it reaches over, it grabs the olecranon. Now it doesn't look like it much on this image, and I quite like that because it means that you have to kind of use your reasoning based on that last slide in order to figure out if it does cross over or not. So it crosses over the bottom here, it attaches onto your olecranon, which is the pointy bit of your elbow, pulls on it, and that's how we get that extension. Okay, make sense?
Yeah.
Perfect. So biceps flex, triceps extend. Really useful little bit here, guys. Flexion is always the opposite of extension. Okay, so if you understand what a flexion movement is at any joint, it looks different at different joints, but if you know what flexion is, the opposite of that is always extension. Okay. So that is elbow done. The only other movement available at your elbow, anybody know it? What other movement can your elbow do? It's a bit counterintuitive, this one.
Yep.
Rotate.
Perfect. Yeah, absolutely. Yeah, Karen, you were demoing that for us there really nicely. So we're doing that pronation, supination. So that's an elbow movement. Okay, it looks like a wrist, but if you actually grab here below your wrist and you hold your forearm in place, don't let your forearm move, you actually can't move either way there. So we know that it's not a wrist joint thing. It's coming from elsewhere. Okay, so that is an elbow thing, or it's really your kind of bones of your forearms are rotating around each other. Okay, cool. Happy with that, guys?
Yeah.
Perfect. So here we looked at the glenohumeral joint, which is a bit of a mouthful. It's just your shoulder joint. Okay, your shoulder joint is what type of joint? Anybody know?
Ball and socket.
Ball and socket. Yeah. So ball of your humerus, socket is on your scapula or your shoulder blade. Scapula, shoulder blade, same thing. Okay. So ball and socket joint. If we look at a ball and socket joint, would you say it has lots of movement? Not very much movement. What do you think?
It's got lots of movement.
Yeah, lots of movement. Absolutely, yes. We look at it, we can kind of see probably going to be able to move in lots of different directions there. Okay, so your shoulder movements, I'll stand away a little bit. So shoulder movements are your abduction, adduction. We've got your flexion, or vertical flexion sometimes called. Opposite of this movement, I'm going to do that now. What do you think that's called?
Extension.
Extension, right? Because it's the opposite of flexion. Yeah, perfect. So if I'm going to do some horizontal flexion now, okay, so that was horizontal flexion. I'm going to do that again. Okay, so this is horizontal flexion. Okay, can everybody do some horizontal extension for me? Yeah, perfect. So you've just done the opposite, which is that. So exactly that, guys. That's horizontal extension. Okay. Now shoulders can do something else as well. What is that?
Rotate.
They can rotate, absolutely. Yeah. So quite a fun way to observe this, guys. Put your hand like that for me, palm up. Okay. Now I don't want you to think about turning your wrist over like that at all. Okay. And I'll make you do it without even realizing. So what I want you to do is bicep curl for me. Okay. Bring your hand down in front of you. Come back out to your start position. Bicep curl again. Come down in front of you. Come back out to your start position. And you'll have all turned your hand over. Yeah. So that is coming from your shoulder. Yeah. So we're internally rotating it. So I can turn my hand over via my shoulder, which is effectively what we've done there. There will have been like a little bit of wrist, not wrist, elbow movement going on there as well, but that's mostly kind of shoulder movement that led to that. Okay. So that is your external rotation. That's your internal rotation. So everybody that can, obviously, if you have injuries that stop you doing any of these movements tonight, just don't do them. That's fine. But everyone who can, pop your hand up on the back of your head. Okay. What kind of rotation did you just do?
External.
External, absolutely. Yeah. Which means if you put the hand on the small of your back, we've had to do internal rotation in order to reach around there. Yeah. Cool. So these are your rotator cuff muscles. You've probably heard of a rotator cuff before. So it's made up of 4 muscles that all kind of pretty much share a tendon. Okay, so they've got their own kind of little attachments to it, but they're pretty much sharing one kind of big tendon. So it looks always really nice and neat when we look at a diagram like this, but if we look at it in reality, it's really not that neat. It's just one big sock looking thing that covers over the top of your humerus and kind of sucks it into the ball and socket joint there, and it's one of the things that would help to hold it in place. So rotator cuff muscles, as the name would suggest, they are involved in rotation. They're involved in abduction a little bit as well, but most of all, they're kind of stabilizing your shoulder, and that is through producing rotational forces. But it's kind of producing rotational forces in order to resist other outside forces that are on your shoulder. So if you imagine, if I'm holding my arm like this, if a force were to come and hit me this way, you can see how that force is trying to externally rotate my shoulder. Okay, so my internal rotators, so things like subscapularis, right? Internal rotators are going to be quite active in order to stop that from happening. Okay, so if you were to just prevent that movement, rotator cuffs working quite hard. So all muscles work like that to an extent, but that is largely the job of your rotator cuff. So really deep little muscles. We don't need to remember each name of them. They wrap around the head of the humerus and they hold it in. Okay, very deep muscles. Make sense?
Yeah.
So rotator cuff with the tendon being not like your kind of typical tendon. So if you pinch the back of your heel, guys, you'll feel a kind of ropey tendon there. You probably know the name of it. Your Achilles tendon. You've probably heard of that one before, right?
Yeah.
So that little ropey tendon there, that is not very much like your rotator cuff at all. Rotator cuff, much more of a kind of sheet. Okay, which is why when you get a rotator cuff tendon tear, it's a little bit more like a hole in your sock in terms of the analogy, as opposed to a kind of fraying or snapping rope or something like that. Okay. So do your bicep and tricep cross over your shoulder joint as well?
Yes.
Yeah.
Yeah, absolutely. Yeah. See, if I were to ask you guys to stretch your tricep, what would you do?
Arm out in front.
If you do a tricep stretch, remember your tricep is kind of here, How would you get a nice stretch feeding into that? Yeah, Lynn, perfect. Yeah. So Lynn, if you chat to us and then you'll pop up on people's screen.
Oh, right. Okay. Yeah. Put
Yeah.
your
Perfect. Yeah. So Lynn's kind of coming up like that. So that's how we get a kind of tricep stretch. Yeah. Kind of like that. So you've moved your shoulder in order to stretch your tricep, which means you know that your tricep is doing something at your shoulder. Otherwise, you wouldn't have moved it in order to stretch it because it would have nothing to do with your tricep, right? So a lot of people will kind of know, right, yeah, I'll stretch my tricep or I'll stretch my bicep. Okay, they're actually moving their shoulders into different places in order to do that, in order to get that stretch. So we kind of already know that it crosses over, but you might not know that you knew. Yeah. So it's, they absolutely do cross over. Your tricep is on the back of your shoulder joint, which means it moves it in what direction? I'm not trying to trick you.
Oh,
So if it's on the back, it moves it
back.
back.
Backwards.
Yeah. Okay. Yeah. Perfect. So I promise I won't try and trick you with these guys. Yeah. So triceps on the back, so it moves it backwards. What's that called? That backwards movement?
Extension.
Perfect. Extension. Extension. Yeah. So triceps on the back moves it backwards, which is extension. Biceps on the front does the opposite, which is
Flexion.
flexion. Yeah. So it moves your shoulder up in front of you like that. Okay. Which is why we have to do the opposite. So a tricep, when it shortens, right, it contracts, it'll move you back into extension, like we said, which is why in order to stretch, which is the opposite of that, which is lengthen it, we have to do the opposite, which is to flex it all the way up here. Yeah, so that's why that stretch works. Does that make sense?
Mhm.
Yeah, perfect. So lat. Lat is a huge muscle. We're going to have another look at them later on tonight. They, as you can see, cross loads and loads of vertebrae. Out of all of your core musculature, this crosses the greatest number of vertebrae. Okay. They cross over the shoulder joint, as we can see there. Okay, they're crossing over a couple of joints. So we can definitely say that that's going to have an impact on where your arm is because it is directly attached to your arm. Yeah. So if you guys put your arms anywhere, put each arm in a different place. Go nuts. Yeah, perfect. So if you are to now bring your arm to your side, so think about humerus, right? We're to bring your humerus to your sides from wherever it is. If you were to imagine that that movement that you've just done was against resistance, your lat would have been involved with that. Okay, so instead of memorizing all the different names of the stuff that your lat does, we just know your lat pulls your arms to your sides whenever we're working against resistance. So lots of you did a movement like this, right? What's that movement called in the gym where you grab a bar and you pull it down like that?
Lat pull down.
Lat pull down, absolutely. So that's why it's called a lat pull down, because your lats are used to pull your arms down, yeah, to your sides. Okay. So that makes more sense because if your lats take your arms to your sides from wherever your arms are, that means that from an extended position, they will do flexion. From a flex position, they will do extension. From an abducted position, they'll do adduction. And from an adducted position, they'll do abduction. And they also do a bit of internal rotation as well. So instead of memorizing all of that stuff, I think it just makes more sense to understand that wherever your arms are, it will bring your arms to your sides. And then whatever that movement was is what your lat just did. Yeah, does that make sense? Yeah, perfect. Okay, so pecs. Whenever pecs are in their shortest position, well, let's have a look at them. Can you see the grain of the muscle on your pecs there?
Yeah.
Okay, which direction is that kind of grain of the muscle going? Horizontally. Yeah. So what sort of flexion do you think your pecs are responsible for mostly?
Horizontal flexion.
Exactly, horizontal flexion, yeah. So horizontal flexion, we said before, was this coming in front. So you guys answered horizontal extension when we asked before. Horizontal flexion is this. So when your arms are here in front of you, that is your pecs in their kind of shortest position when your arms are here in front of you. So from wherever your arms are, even if they're in different places, if you were to come to here, your pecs will be involved with that. Okay, make sense?
Yeah.
Perfect. So deltoids, again, deltoids, don't try and trick you. That is the shoulder muscle, the one that sits up around here, across the top of your shoulder joint. They are split up usually into kind of 3 categories. Okay, it's actually made up of about 19 different muscle spindles. Okay, so whichever direction your arm moves is kind of dictating which portion of your deltoid is working. it's split up into 3 parts: front, side, and back. The front portion of your delt, which direction do you think that moves your arm?
Forward.
Forwards, exactly, yeah. So the front portion of your delt here moves your arm forwards. What's that called?
Flexion.
Okay. So what is the rear delt doing then?
Extension.
Extension, yeah, it's moving it back. Which direction does the side delt move your arm?
Horizontal. Abduction.
Horizontal. Yeah.
Abduction. Abduction.
Adduction.
Abduction. B for
Yeah.
beta, yeah. So abduction. So your side delt moves them sideways, which is abduction. I see why you'd say horizontal. Horizontal is more kind of through here. So that movement there will probably be a little bit more rear delt involved in pulling it back, and then front delt involved in pulling it forwards. And side delt might be a little bit active just to hold your arm in that position, but mostly your side delt, if it contracts, brings you up to about here. Okay, so that's your kind of side delt working quite hard. Okay, you imagine if I kind of reached over here and pulled on my arm, how that would kind of pull it up. Yeah, that's side delt.
Okay.
Okay, makes sense? Perfect.
Yeah.
Okay, so back to the same picture, circling a different thing, and I'll slow down now and we'll have a little bit of a chat through scapular thoracic joint. Oh, that's the chat going there, just bear with me guys 2 seconds. No worries at all, Babs, that's absolutely fine. You go ahead.
You've already priorly engaged, so I just wanted to say I have to go. Yeah, so but I'll be back.
No problem. No problem.
Right,
If you do come back, we'll let you in, but it's all recorded anyway. That's fine.
Oh, great. Okay. All right. Thank you.
Perfect. Cheers now.
Bye-bye.
Bye.
Bye.
So we're looking here, guys, at your scapular thoracic joint. Okay, so that's what we're going to chat through now. Okay, scapular thoracic joint. Can you guys translate that for me?
Shoulder blade in your chest. Your
Shoulder blade, and we're looking at the back of this person here.
Rib cage.
So ribs. Yeah, absolutely. Yeah. So shoulder blade and rib cage, basically. So it is essentially the movement of your shoulder blade on your rib cage. Okay, which is nice and straightforward. Yeah. So what sorts of movements? Can you guys move your shoulder blades around?
Round.
Yeah, absolutely. Yeah, kind of doing this sort of thing. Yeah, absolutely. That's all kind of shoulder blade movement. Okay. So if we move on, we'll have a little look. Now, this is kind of a little bit of a weirder joint because it's not really like 2 bones meeting. Okay, like your shoulder blade and your humerus, a bit more straightforward. Or if we're getting your kind of humerus and your ulna, okay, that's a little bit more straightforward as well. This is a little bit more annoying, right? It's not quite as clear as that. But if we just know that muscles attached to bones and pull them whichever direction they're attached to them, that makes it a lot simpler. Okay, so first of all, we'll just kind of have a look at the movements that are available. In theory, yep, there we go. So we've got 4 main movements going on here. Can everybody elevate your scapula for me? Perfect, that's the one. This is always the one that we say, even if you don't know the answer, you might still get it right if you shrug. Yeah. So everybody shrug up, that is your elevation. Okay, can we depress your scapula for me? Yeah. Don't copy me, I'm not doing it yet. Yeah, I'm still elevated here. So you guys depress your scaps for me. Yeah, perfect. So shoulders coming all the way down. That's shoulder blade depression. Okay, can we retract your scaps? Pinching back. Yeah, perfect. So squeezing back behind your back. Okay. And then can we protract your scapula?
Punch forward.
Punching forwards like that. Yeah, perfect. Okay, so up, down, in, out, right? Nice and straightforward for shoulder blades. Just 4 things they can do. Just look where the muscles are attached to your shoulder blades, and then we can figure out which direction it's going to pull them. Okay, if the muscles are above, it's probably going to pull up. If the muscles are in front, probably pull forwards. If they're behind, probably pull backwards. If they're below, probably pull downwards. Okay, we know the names for all of that. Okay, up is elevation, down is depression, back is retraction, forwards is protraction. Okay, all that makes sense?
Yeah.
So bit of a mouthful. Okay, scapular humeral rhythm. what do we think that is kind of trying to show us?
The degree of movement.
Yeah, range of movement.
Range of movement, yeah.
Range of movement, yeah, absolutely. Are we looking here at one joint or two joints?
What it'll be the joint between the scapula and the rib cage, and then the shoulder joint as well.
Perfect, Paula. Yeah, absolutely. Yeah. So we're looking at them both, and they've both moved. Yeah. And that's resulted in an overall movement. Okay, so we've got 60 degrees at shoulder blade, 120 degrees at shoulder joint, which results, if you add it together, in 180 degrees of overall movement. Yeah. So scapular humeral rhythm is just a kind of fancy way of saying your shoulder blade moves around in order to help your shoulder joint move around. Okay, so if your arm moves up, your shoulder blade moves up to help it. If your arm moves back, shoulder blade moves back to help it. Forwards moves forwards. Yeah. Same sort of idea. So it's not again, not trying to trick you. It's the same sort of stuff there as you go through. It's nice and straightforward. If we have two moving parts, this results in more overall movement. Okay, so if I just move my fingers down by themselves, I get to there. If I bend more knuckles, I get my fingers a bit further down. If I bend my wrist, I get them further down. If I straighten my elbow, I get it further down. So like the more moving parts we introduce, the more overall movement that we get. Okay, that's why our shoulders are so useful. That's why they can move around as much as they do. Okay, our hips don't have quite the same capability. A little bit because your pelvis can move around via your spine, but mostly you're quite locked in there. So that's why your hips can't move to the same degree as your shoulder can. You can't do that with your hips. Or if you can, I'll be very impressed, right?
You don't know what any of us can do.
Sorry, yeah, maybe you can. I would highly recommend booking in with me for physio if you can do that.
I was going to say a trip to the A&E if you find your hips doing that.
Yeah. So that's our shoulders can do that, and our hips can't. They're both ball and socket joints, though, right? So the ball and socket joint's relatively similar. It's just that your pelvis doesn't help to assist that movement in the same way as your shoulder blade does. Okay, this was a lovely video which has decided to desert me this evening, and it was a nice video of scapular humeral rhythm. So what I'll get you guys to do is just have a little YouTube of scapular humeral rhythm at some point. If you're interested, don't worry if you're not, but if you're interested, have a little YouTube of scapular humeral rhythm, and you'll be able to see how the shoulder joint is moving to aid, how the shoulder blade is moving to aid the shoulder joint. So it's quite a nice video that has decided to leave us for some reason. I'll see if I can get the link working again. Okay, so some of you may know the name of this muscle, some of you may not. If you do know it, don't say it just yet. What we're going to do without knowing the name of the muscle is try and discuss what it does. Okay, so without knowing what it is, and some of you may not have known that there is a muscle there even. So I'm telling you that there is, and we're now going to figure out what it does. Okay, can you all see the kind of grain of the muscle there?
Yeah.
Okay, what do you notice about the grain of the muscle?
Well, some of it's yeah.
Okay, absolutely, yeah. So some of it is horizontal, some of it is a little bit up this way, some is a bit down that way. Yeah, so different directions of muscle fibers. Do you think this muscle group can only do one movement, or do you think it's helping us do maybe a few?
Few.
Several, yeah.
Definitely doing a few, yeah, absolutely. Okay, so it's attached onto what's called the spine of your scapula, which is this kind of jutty outy bit there. Okay, to use its technical term. So if we see that bit there, okay, that is the spine of your scapula. Okay, so I know you can't really see your shoulder blade in this picture here, but you can see it attaching on there. Okay, we can also see shoulder blade just down there. Okay, it's attaching onto your spine, so we can see spinous processes peeking out there. That's the kind of lumpy bit. See, if you see somebody kind of arch their back forwards, you can see the kind of bony bits going up their spine. Those are spinous processes, so that's what you can see there. Comes all the way up the spine, attaches up into, if you'll feel around the back of your head, around about here. Okay, you can feel like a little bony lump at the back there. That's called your occiput. Okay, so they're coming right the way up and attaching into that as well. Okay, so just looking at shoulder blade movements. Okay, Can you guys tell me which bit of your of this muscle, which bit can do retraction?
The
Middle bit,
but
Middle
yeah,
bit, absolutely, yeah. Why are we thinking the middle bit? You're 100% correct.
because it's pulling your shoulder blades in towards each other.
Pulling them straight toward each other, isn't it? Yes, that's the direction of the fibers pulling straight toward each other. We know that that section of your spine, that's not going to move, partly because your spine doesn't really move like that, certainly not segmentally, and secondly because it's getting pulled in two opposite directions, which means it's going to stay where it was even if it could move a lot. Okay, so we know that the shoulder blade is going to be the moving bit. Make sense? That'll pull your shoulder blades together. Absolutely cool. What other movements do we think it can do?
Kind of like a rotatey upwards, like a 90-degree upwards.
Yeah, absolutely. Yeah. So what is that upwards movement called?
Elevate.
Yep, elevation. Yeah, absolutely. Yep. So elevation and that kind of rotation, you're absolutely correct. That's kind of how it moves. So you can see here how that so that's elevated scapula that you see in there. So you can see how that trapezius, that bit there, that is the trapezius. Sorry, I've just given you the name of the muscle. It's your trapezius. So I find it really difficult not to do that, right? I'm going to try and do that again on other muscles so you can catch me out, right? But there we go. So trapezius, it's called. That is the upper trapezius, and that's attached onto spine of your scapula there. You can see how that bit is shorter than its corresponding bit on the other side that's not contracted. Does that make sense to you guys?
yeah.
Yeah, cool. So that bit right up there, that's kind of trapezius. Okay. And we can see that rotation of the scapula. So it does kind of rotate a little bit. So when it comes up, it's kind of like that. When it comes down, it's kind of like that. Yeah, and out and in, it stays quite stable. Okay. So any other movements?
Downwards or kind of
Downwards.
pushing down.
Absolutely, yeah. So pull it downwards. And we can see that it's the lower fibers, or the fibers that are at the bottom there with that downward direction that's going to pull it downwards. Okay, that makes sense?
Yeah.
Yeah.
Did anybody know the name trapezius before I blurted it out?
Yeah.
I've heard of it, but if you'd have asked me to point at it, I wouldn't have known.
Perfect, cool. So some of you knew, some of you not so much. So perfect. So those of you that weren't aware, you're able to kind of figure out what it did before you knew the name of the muscle, right? So this is why we're not kind of just trying to memorize trapezius does elevation, retraction, and depression. We're actually kind of just trying to reason by looking at stuff what it's going to do, and I think that's more useful anyway. Cool. So lats. What do we think about lats? Do you think they do anything at your shoulder blade?
I should think it's part of the rotational movement of, like you were saying in the shoulder joint, when the shoulder joint moves, it's partly because of your scapula and partly because of, involved in that way, kind of. I'm not making myself very articulated, am I?
You're absolutely onto the right track. So yeah, definitely right tracks. What sorts of movements do we think it can do? Is it above your shoulder blades? Behind? Below? In front? Below? Yeah, absolutely. So lats are below your shoulder blades, we can see there, yeah. So if they're to contract, which direction is it going to pull your shoulder blades?
Back.
Say again.
Back.
Down and maybe inwards.
Down and maybe a little bit inwards. Yeah, absolutely. Yeah, I would agree with that. So lats are mostly, they look a little bit kind of counterintuitive when you see the different kind of directions, all that sort of thing, but they will mostly kind of be pulling shoulder blades down. So even if it's attached onto humerus, right? So your lats kind of come up here. Okay, it's coming underneath and it's attaching onto humerus here. Okay, now it grabs your arm. And if I were to grab your arm here and pull it down, it pulls your shoulder blade down. Even though I'm not holding your shoulder blade, if I grab your arm here and pull it down, that pulls your shoulder blade down. Okay, so they do scapular depression mostly. So shoulder blades will kind of come down like that. That makes sense?
Yeah.
Yeah, perfect. They also do lateral flexion of the spine. Do one at a time. Bless you, Louise.
Thank you.
Right. So they do lateral flexion of the spine. Okay, so if I'm to contract my right lat, okay, that is going to bring me down to the right. If I contract my left lat, it'll bring me down to the left when it's in its shortest position. Okay, really strong lateral flex of the spine. Does that make sense, guys?
Does when you
Yeah.
demonstrate it.
Say again, Karen. Oh, no. Cool. Okay, cool. So moving on, guys. Does anybody know the name of that? Say yes or no. Don't say the name of it.
No.
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 No. Perfect. Okay, cool. So most people don't know. I'm going to do my best not to say it. Okay, so if we look at that there, tell me the bits it's attached to.
To your scapula and to your
Spine. somewhere.
spinal.
Yes,
Whatever.
absolutely.
we
Yes,
call
spinal
them.
processes. Yes, so
That's the word.
Yeah,
Process.
absolutely. Yeah. So scaps and spine. Now, if we look at that muscle there and it gets shorter as muscles do, what's going to happen?
Again, it's going to be that rotation and upwards, but slightly inwards.
Upwards and yeah, absolutely. A lot inwards, I would say there. Yeah.
Yeah.
Yeah, absolutely. So what's that called?
Elevation.
Elevation.
Not quite elevation.
Retraction.
Retraction,
Yeah.
yeah, retraction. Perfect, yeah. So it'll do more. This isn't me demoing. This is me scratching my back, by the way. Sorry, guys. So it'll do more retraction. So I am demoing now. So that's that movement there. Okay. So it'll
Okay.
pinch them together. Okay. So that's your retraction. Okay. I completely see what you're saying because there is that slight kind of upward angle. But in order to move your shoulder blades like really upwards from a neutral position, it would have to be like above them. Okay, so realistically, what it's going to do, if that's your shoulder blades and it's kind of attached like that, it's going to do kind of like that.
Yeah.
Which is really retraction. It's not actually taking them and going like that in the same way that your upper trapezius, which as we saw before, is attached along this bit and then up here into your head. We can really see how all of that stuff is actually going to really pick them up high.
Right, okay.
Does that make a bit more sense?
Mhm.
Yeah, perfect. Cool. So we know the name of one of these probably because we had a look at it before. What's the name of one of these muscles that we're seeing here?
Pecs.
Pecs, absolutely. Yeah. So pecs are the ones on the right hand side of the screen. Now we said what they do at the shoulder joint. Looking at the shoulder blade, what do we think they do there?
Protraction.
Protraction, absolutely. Yeah. So they move your shoulder joint forwards. Okay. That means that shoulder blades help that. So it's also going to move your shoulder blade forwards as well. Yeah. Now you do also have attachment on your shoulder blade from the pec, especially pec minor. Okay, so pec minor is like a small. So we're looking at pec major there. Underneath it and attached to your kind of ribs, just up around here. Okay, you've got like a smaller muscle group which comes up and attaches across onto this little guy here. So that's sticky, outy, bony bit, coracoid process of your scapula. Okay, so that's going to protract. Okay. So this other muscle group that we're seeing on the left, okay, not a lot of you will have probably heard of that before.
Yeah.
We'll say the name afterwards, but looking at it, we can kind of figure out what it does. So we're looking sideways on at this person, and they don't have an arm on this side, so we're looking straight into the socket there. So the ball, the humerus, has been removed, unfortunately, for this person. Although it doesn't look like that's their main concern at this stage, but anyway, that is the socket of the scap there. Okay, and we're seeing that that's actually traveling underneath. So we're looking at, oh, sorry, right. I hope you didn't see that. We're looking at the outside border of the scap there, and then this muscle's coming right underneath it and attaching to the inside border. Okay, and then it's wrapping around the front of the rib cage. Would we agree with that?
Yeah.
Yeah.
So if it's attached to your shoulder blades and then it wraps around the front of the rib cage, what do we think it does when it contracts?
You'll get a horizontal movement away from each other.
Yeah, exactly. So scaps, if we were to look at this person's back, if we look at the scaps, they'll move horizontally away from each other. What's that called?
Traction.
Protraction. Yeah, so same as your pecs, right? Protraction, absolutely. So it's attached right in underneath, and it is going to protract your scaps. So some of you may have seen the next slide when I accidentally moved across. Not very well tonight. What sort of sport do you think we would be using this muscle a lot in? What involves a lot of protraction?
Boxing.
Boxing. Yeah, there we go. So, boxing. So serratus anterior is your boxer's muscle. It's known as, yeah. So a lot of that sort of thing. Yeah. So we can see how there's a lot of protraction involved. Okay. That makes sense? Okay. Can you think of an exercise where you're really pushing forwards?
Bench press.
Bench press, absolutely. Anything else?
I do something called that my personal trainer calls chops. It's when I've got it's like a hybrid.
Yeah. Cool. Yeah, so doing that on a kind of cable, yeah.
Yeah.
So the side that's kind of coming across from here, that's absolutely going to be protracting as you come like that, yeah. Push-ups. Yeah, push-ups, we'll be really using that, yeah. So bench press, interestingly, we probably don't use it that much because we've got that bench at our back, so it actually is more important for us to be keeping our shoulder blades back and stuck to the bench, because that gives us a really solid surface to push off of to do kind of that from. Okay, whereas if we've got this going on, we lose that solid grounded position. So interesting one there. You may find though that you still get quite a lot of tension through them, but we're just not actually pushing forwards, we're just kind of holding solid. Okay. Now we can see a bunch of muscle groups here because he's a very lean guy. So what am I looking at just there? See where my cursor is? Oh, it's gone. I'll bring it back. What are we looking at just there?
Trapezius.
Trapezius, yeah, and specifically the upper trapezius, yeah, so this bit here. Okay. What are we looking at here?
Deltoid.
Deltoid, yeah, so that kind of round muscle that comes around the top of your shoulder there. Yeah, absolutely. Okay. What's this muscle group here?
Bicep.
Bicep, and this one down the back of the arm.
Tricep.
Tricep. What's this muscle up here?
Lats.
Lats, absolutely, yeah. So seeing the lats coming around the side there. What's this muscle here?
Serratus anterior.
Yeah, well said. Yeah, perfect.
As
Yeah,
per the slides.
Serratus anterior, as per the slide. Yeah, perfect. And this muscle here.
Pecs.
Yeah, perfect. So pec major we're looking at there. Now you can literally see the horizontal fibers, right? You can see the grain of the muscle almost. This guy's super lean. Okay, we can see some abs going on as well. I think that's most of the muscles that we've kind of chatted through tonight. Yeah, perfect. Okay.
So I'm interested to see that serratus, whatever you call it, anterior thing.
Yep.
Is that the green thing that was on your slide?
Yep, that's it, yeah.
I got kicked out of the meeting, sorry. I missed that bit.
No worries. Yeah, that's it. So that one there, serratus anterior, that's what we're seeing right there.
That's the boxers one, right? Lovely, thank you.
Yeah, that's it. Okay, so see what time we're. Yeah, we'll do grand. Let's talk through this one. Okay, so this incidentally, I have a whole kind of tutorial like Mastermind that we do on this, but this is how I like to get people to progress their push-ups. So just doing them on an elevated surface to begin with. Okay, and then we do them onto lower surfaces like so, and like so, and like so, in order to progress. Okay, so that's kind of a nice way to progress your push-ups, is gradually reducing the height of the surface you're doing them onto instead of doing the whole knee thing. It's just a little bit more of an incremental way to progress it. That's quite a nice way to do it. So what joints are moving? Give me three main ones.
Wrist.
Okay, not so much wrist. Now wrists are moving, granted, but quite limited, right? So they stay, even when we're pressing, they stay relatively still. Somebody said elbow. So
Elbow, shoulder.
yeah.
and the scapular rib.
Yeah, absolutely. Yeah, perfect. So elbow, shoulder, and shoulder blade, yeah, or scapulothoracic joints moving. Okay, now in order to figure out what muscles are working, okay, we have to figure out what's going on when there's resistance. Okay, I know there's resistance both ways, but we'll figure out what's going on whenever the weight moves upwards. That's the easiest way to do it. It's the most straightforward way to do it. So the weight in this case being me, what is happening? Let's do the elbow first. What's happening at the elbow whenever I move upwards?
Triceps extending.
Absolutely. So elbow is extending and you're ahead of us there. So what muscle group extends your elbow is your triceps. So yeah, 100% correct. Yeah. So that's the way we figure it out. So we look what joint is moving, which direction is it moving when the weight moves upwards, and what muscle group is responsible for it moving in that direction. And that tells us how to figure out what muscle groups are working during an exercise. Okay, so that's elbow done. So triceps, absolutely. Shoulder joint. Now we've looked at shoulder blade mostly tonight. I'm asking you now about shoulder joint. So that's the one we did the recap on. A little bit of a weird one to make out here, but see if you can isolate the shoulder joint movement and tell me roughly what that movement is. So just joint movements. Don't tell me muscles just yet. I just want joint movements.
That horizontal extension.
Whenever the weight moves upwards.
Flexion.
Flexion. Yeah, perfect. Yeah, absolutely. Yeah. So absolutely right tracks. When the weight moves upwards, we've got that forward movement there, which is more flexion.
Yeah. Okay, yeah.
We want to kind of isolate that. So that's your push-up movement. Okay, but we're actually just looking at the shoulder joint. So we need to forget about what the elbow joint's doing and just look at that. Yeah. So that's the exact same movement with my elbow straight. That's the same movement with my elbow bent. Same thing. Okay. So we've got your horizontal flexion. Okay, perfect. So what muscles do horizontal flexion?
Del. Horizontal flexion.
Biceps.
Biceps.
Biceps will be a very little bit involved in horizontal flexion. There'll be a little bit of flexion going on from biceps, yeah. Delts, which bit of your delts?
The front bit.
Front bit, yeah, absolutely. We'll move it forward, and that's flexion. What is the strongest? So that's a couple ones there. What's the strongest muscle that's going to be involved in horizontal flexion? Can everybody do some horizontal flexion for me? Both hands. So do horizontal flexion and then just hold it in your most horizontally flexed position. Yeah, perfect. So Louise, you're spot on there. A couple of people are going horizontal extension, so I want you to be horizontally flexed at the minute. Okay, so hands should be here, horizontally flexed. Yeah. What muscle group did we say brings your hands to here?
Lat.
Not quite lats. Lats bring your arms to your sides.
This bit, whatever it is. Shoulder.
No.
Delts, yeah. So we said front delts. Yeah. We've said that, but what's the stronger muscle?
Lats.
Not lats, no, they bring your arms to your sides.
Pectoral.
Yeah, pectorals, yeah, absolutely, yeah. So do you remember when we saw that slide and we said horizontal fibers do horizontal flexion? And it's at the front. Yep, absolutely, yeah. So pecs. Okay, perfect. So that is shoulder joint done. And sorry, I'll just move back to the video. Okay, so that's shoulder joint done. Now we also said shoulder blade move. So whenever I move upwards, what direction is the shoulder blade moving? Remember, always support shoulder joint movement.
They're going away from each other, outwards.
Away from each other, so moving forward, isn't it? So my arm moves forward, so my shoulder blade does that as well. Yeah, so it moves forwards. What's that called?
Protraction.
Protraction, absolutely. And what muscle groups were involved with protraction?
Easy thingy, was it? No, the other one.
Say again, sorry, Lynn.
I want to say trapezium, but it's not that one. It's the other one. Rum something. Rum.
Not quite. So those
Good.
two do the same thing. So you're correct there, but they do retraction instead of protraction.
All right.
So what moves it forwards?
Green fingery ones.
Yeah,
Green
the
finger
one, the one that's
absolutely,
got
yeah.
two words in it.
Yeah, so serratus anterior, absolutely. Serratus anterior. And what was the other muscle group that was also on that slide?
Pecs, your pectorials.
Pecs again, yeah, absolutely. So they're working at shoulder blades as well as shoulder joints, yeah. The serratus anterior, by the way, if you were to cut someone open, that won't actually be green. Just in case just in case you do that and you're disappointed, right? So it'll all be red. I don't know why, but it's on a website called KenHub, by the way. It's a really cool website. If you want to learn anatomy and that sort of thing, it's got some really nice kind of educational content. So if you want to have a look, please go and have a look. But yeah, all of those kind of green ones like that, and that I think lats as well. Yeah, there you go. So KenHub, there you can see kenhub.com at the bottom there. So really cool website. But yeah, for some reason, makes muscles green. There we go. Cool. Right. I shall leave that there. So we've looked at a push-up and figured out that we've got triceps, front delt, pecs, and serratus anterior working whenever we're doing that. Okay, just by learning your kind of joint movements and what have you. All that roughly makes sense. I know it's a lot of info, but as we go through it, it makes sense, yeah?
I think when you're demonstrating it, it makes sense, but I have to say it's like trying to learn Japanese at the moment.
Yeah. It's it does take time for sure, this sort of thing. But if you have a better idea now than you maybe had at the start of the session, then we're headed in the right direction. So that's the main thing. Cool. Any questions, guys, before we go? It doesn't have to be specifically about tonight's session. It can be, but it can be just about training in general.
So because you've been talking about shoulder blades, only because I had a problem with this about 5 or 6 days ago. That feeling when, so the way I described it to my sister was, I feel as if I've pulled a muscle around the outside of my shoulder blade. Yeah. So, but having looked at the muscle groups and things like that, it's like, do you know what I mean when I say that? I'd been doing quite a bit of swimming, so I don't know whether it was that or I'd been doing some heavier weights. But what's the best stretch to help that kind of?
Yeah. So first of all, I'd have to ask you a bunch more questions in order to figure out which muscle group it was that's bothering you, and if it was in fact a muscle group, because there's other structures and tissues in that area that can cause discomfort and pain. And then in terms of what could help it, it probably most likely wouldn't be a stretch. A lot of the time we're more prescribing kind of strength exercises and that sort of thing. Now, if it was maybe a little bit of DOMS, like delayed onset muscle soreness, we don't really need to do much at all apart from wait for it to go. But if it is a little bit more than that, then it would have to be a kind of physiotherapy assessment in order to figure out what's going on and then prescribe a kind of management for it. But typically it wouldn't be stretches that we would give for that sort of thing. It's most likely more strength.
So me doing this wasn't helping.
Yeah, probably not, but we can certainly have a chat. We can certainly have a chat about what's gone on. If you just use my link, you can book in and we can go through it. That's not a problem at all.
Yeah, it's gone now, but if it was a continued problem, then yeah, I will.
Cool.
Yeah.
No worries at all.
Tristan, I've said to you before about just that this sort of nasty, like this sort of slightly crunch on just one side when I do a lat pull down, one arm one. And what sort of thing would cause those sort of crunchy movements?
Loads of stuff can cause that. So you can get kind of degenerative changes in kind of the cartilage inside the joint, your kind of labrum, that sort of thing. So labrum, I don't know if you saw some of the pictures, it had like a little bit of a socket outside of the bony bit wrapping around there. So that's kind of like cartilage tissue that just extends the socket a little bit. So you can get little tears and degeneration there that can cause clicking, crunching. It can just be completely normal clicking and crunching. My shoulder likes to click and crunch on the right, doesn't do it on the left. It's no reason to be concerned, as we've described, as long as it's not kind of painful. There's loads and loads and loads of tissue in a very small space there. You've got your kind of rotator cuff that we talked about. You've got all of the kind of ligaments that are attaching various different elements of shoulder girdle together. You've got your bursa. Okay, it's like a fluid-filled sac. It's always like shown on diagrams as being this nice, neat little bubble that sits underneath, but in reality, it's this kind of huge thing. So your biggest bursa in the body, right? So it's this big kind of huge plate that kind of sits underneath there. There's loads of stuff in that area. So if I were to try and put my finger on exactly what it was, would struggle if we were hands-on with you. But what we can tell you is if it's not painful,
Yeah.
issues at all.
No, just when it just goes through you, and you just think, do we just carry on? And you've said before, yeah, it's not a problem, sort of thing. And it's just the feeling of it, you know.
It's not predictive of injury or indicative of pain or injury that necessarily. So yeah, don't worry about that.
Yeah.
Any more questions, guys?
No.
Fantastic. Okay, we shall wrap up there. So next week, I think we're going to be moving a little bit more into lower limb. So we'll look at kind of leg anatomy, that sort of thing, and we'll just kind of keep working our way through it from there. All right, guys, have a lovely rest of your evening. I hope that was tolerable at least, and I'll see you next time round. All right.
Yeah,
Cheers,
that's
mate.
great. Thanks, Tristan. Thank you. Bye, everyone.
Everyone.
Bye.
Bye.